All right, good morning, everybody, and thank you so much for joining us for our quarterly press briefing here at the Child Protection and Family Services Agency headquarters located at 48 Duke Street, Kingston. We want to first apologize for the late start and also to apologize for the absence of our Minister, Honorable Robert Nestor Morgan, Minister of State in the Ministry of Education, Youth and Information, who is unavoidably absent. However, we want to recognize Mrs. Rosalie Gage-Gray. She's our Chief Executive Officer here at the CPFSA. To my right is Dr. Joy Brown. She's the Principal Director at the Institute for Applied Social Research, IASR. Online, we have Mr. Doug Green, Program Officer, Human Rights, Education and Empowerment at Winrock International. In the audience, we have Mr. Newton Douglas, who is our Director Policy, Planning and Evaluation here at the CPFSA. And also in the audience, we have Ms. Octavia Spencer, and she's our social worker, or one of our social workers here at the CPFSA. We have some resource persons who are also online with us. Mr. Warren Thompson, he's the Deputy Registrar here at the National Children's Registry in the CPFSA. Members of the media, thank you so much for joining us. And so today, our running order, we will start with Mrs. Gage-Gray, who will open with some brief remarks looking at the status of children in the care of the state. Thank you.
Dr. Joy Brown, Principal Director, Institute for Applied Social Research. Mr. Doug Green, Program Officer, Human Rights, Education and Empowerment, Winrock International. Mr. Newton Douglas, our Director, Policy Planning and Evaluation, who is in the space with us this morning, and all members of the executive who have joined us online. Ms. Octavia Spencer, our social worker from our SMILES mobile unit, that's the mobile mental health unit. Members of the media, pleasant good morning. The last few days has been nothing short of horror as we receive reports of children who have been caught in the crossfire, are witnesses of violence, or who have been left motherless and fatherless. As our children are affected by the levels of violence in our country, we have to redouble our efforts to respond to their emotional, physical, and psychological need as they face the trauma that they would have suffered. Our first responders have been at these scenes providing initial statistics that comes into us primarily through the National Children's Registry. During the period April to June, we have 1,200 the National Children's Registry. We saw a drastic decline in that first year, that's 2020, with April of that year. But since April of this year, we are seeing an average of between 800 and 900 cases per month. Between April, you're seeing table 2. Can we see table 1, please? So table 1 shows that since the start of the year, we have 5 1,564 cases reported between January to June, and you would have seen depicted there the numbers for the other years. And if we are halfway there, we see that we will possibly surpass the numbers for 2020 as the year unfolds. Between April to June, we have received 2,988 cases, which is 1,318 higher than the corresponding period, April to June 2020, and that's depicted in Table 2. In May and June, we are seeing the numbers now back over the 1,000 mark, having been down for the last couple of months as we go through the pandemic. And whilst we want to receive the reports, we really want to see a reduction in the number of abuses being committed against our children. We are seeing some parishes in particular that we call hotspots. Westmoreland, St. James, Hanover, St. Anne, St. Catherine, Clarendon, Kingston and St. Andrew, and worrying trends in St. Mary, especially with sexual abuse cases for the younger children. In terms of the types of abuse, could we go to Table 4? We see the types of incident types. There are sexual abuse, physical abuse, children exhibiting behavioral challenges, neglect. And for all of the case types, we are seeing an increase over the January to March figure in the April to June figures there depicted. Between April to June, we are seeing neglect and behavioral challenges are the two leading types of cases reported. And the Table 5 is depicting the comparison with the cases January to March and April to June. So you are seeing depicted there the increase in each case type over the period. Our Children and Family Support Unit continues to provide immediate and ongoing interventions for vulnerable children and their families. The role of the unit is to divert children from coming into the care of the state. These children who are exhibiting behaviors that we think would need intervention are seen by these officers in the Children and Family Support Unit, and we provide the support, direct support through counseling, and also provide referral services to other allied agencies so that we can get the help that the children can get the help that they really need. Over 4,000 children are currently beneficiaries of the program since the start of the year. Under the multi-agency program, the CPFSA works closely with the network of partners for intervention to be carried out for children and their families. These primarily Victim Services Division, Ministry of Labor and Social Security, and CISOCA. We do note that we are seeing an increase in the numbers of cases that are persons who are being charged and taken before the courts, and we thank CISOCA from the JCF for that for us, which is quite, it seems that we are getting there. People are reporting, we are seeing action being taken, and persons are being brought to justice for the atrocities that they have committed against our children. Whilst we work with our partners to divert children from state care, there are some children who do come into care through our place in our living in family environment programs and in our residential programs as well. Table 7 highlights that at the end of June 2021, there are 4,580 children in state care. 3,021 or 65% living in the familial environment. We believe that the best place for children is in families, and we have been emphasizing and pushing. We have a very ambitious target for 2023 for 75% of our children to be living in families, and we are working very hard to get to that figure. So you can see the distribution across the different program types that we have within the agency. We continue our public education drive to ensure greater protection of children and reporting of child abuse through community sensitization, walkthroughs, and motorcades. As we traverse our communities, knocking on doors and engaging our citizens, our hope is that the message of child protection is at the forefront of their minds. The cost we pay to mend our children could be better spent building them. We are therefore calling on every well-thinking Jamaican. You may be a potential perpetrator who is thinking about harming a child. We are speaking to you this morning. You are a relative in a home. You are a neighbor who hears, sees, and remains silent. We are speaking to you this morning. It is time for us to stop harming our children. Know the signs of abuse. If you see it, hear it, or suspect it, report it. Call 211. Call 88-PROTECT, 876-878-2881. And as you know, we will launch 211 later this year in September, but we can still field calls through that number. Thank you.
So how much of what they did there is in the chat? We have Miss
We'll go back to where we started with the statistics. So table 1 is depicting the reports we have received. That's the one in the brighter color, not the blue. 5,564 cases through the National Children's Registry. For the period April to June 2021, 2,988 cases. That's table 2 there. This is 1,318 higher than the corresponding period, April to June 2020. And we are also saying that for the months of May and June, we are back over the 1,000 mark for cases reported. We highlighted some parishes that we are tracking and providing intervention in, which we call our hotspots. Westmoreland, the Western Belt, Westmoreland, St. James, Hanover. We have St. Anne, St. Catherine, Clarendon, Kingston, and St. Andrew. And we are seeing in St. Mary increasing cases in sexual abuse being reported there. Table 4 highlights the types of incidents that are reported, and we are comparing the January to March to the April to June period. And for all the case types, we are reporting an increase over the corresponding quarter, January to March. And table 5 is just showing the graphical representation of that. Our Children and Family Support Unit, which is our direct response to parents and children seeking support without going through the court system, have seen since the start of the year over 4,000 children through the multi-agency program with SISOCA, with the OCA, with PATH, Victim Services Division. We are collaborating and we are seeing some results there. We commend the JCF for the increasing number of cases that have been brought before the court through their investigations and actions. In terms of referrals, during or after the investigative process, you'll see the main areas that we do referrals to based on the issues that are coming out of the investigations, and that's depicted in Table 6. Children in state care, direct care, we have 4,580, and we are seeing 65% of them in our family environment programs. So this is foster care or reintegration program or children on supervision orders. And we have a very ambitious target for 2023 to have that number move to 75%. And that is a recap of the statistics that were presented this morning, and we'll field questions as we go on. Thank you.
Thank you, Mrs. Gage-Gray. Right. So we will send these slides and whatever information Mrs. Gray presented earlier to all members on the platform who would have missed any information there. All right, so we're now going to invite Ms. Octavia Spencer, our social worker in the psychology unit. She will look at the mental health services that are provided for children in state care. Ms. Spencer?
Greetings, everyone. Before I begin my presentation, I would like to take a minute to specially greet our panelists, our CEO, Mrs. Rosalie Gage-Gray, Dr. Joy Moncrief Brown, Mr. Doug Green, who is with us virtually, Mr. Newton Douglas, Miss Melody Samuels, members of the media, and everyone else who is present with us both physically and virtually. Good morning. It is my pleasure to stand here this morning to engage you all in a presentation on the mental health services provided for children in state care. Our aim at the CPFSA is to provide quality services to children in need of care and protection. Children who have suffered trauma due to abuse and neglect require therapeutic interventions. Our psychology unit has been working very hard to assist these children in overcoming the psychological impact they are often faced with due to abuse and neglect. Especially now with the pandemic, we're seeing the pandemic and the previous lockdown, we're seeing where quite a number of our children require extra support, not just here in Jamaica, but globally as well. They worry about their caregivers, they worry about their families, they worry about their friends being harmed by the virus. They are not able to go out and interact as they would normally do in schools, and so we see where additional support and interventions is definitely needed. Our psychology unit has continued to ensure that even with the pandemic and closure of schools, children in state care who require mental health support are still receiving it. Our unit has been doing teletherapy as well as face-to-face sessions in office or by traveling to the different facilities. Our psychology unit is currently equipped with 4 regional clinical psychologists that provide psychological and therapeutic services to children in state care. Within our psychology unit, we have our mobile mental health unit, in which I serve as a children's officer. Our mobile mental health unit is equipped with 2 children's officers who also provide mental health services to our children in state care. Numerous studies have shown that repeated abuse and neglect can result in negative psychological impacts on our children. Nadine Burke-Harris, a Surgeon General of California, is popularly known for linking adverse childhood experiences and toxic stress with harmful effects later on in life. And these harmful effects can be negative psychological impacts. I must also say on the topic of the adverse childhood experiences that this is also one of the instruments that we use in our psychology unit to screen children, where we check for the levels of trauma that they would have faced. I believe we all have a duty to pay extra attention to our children. We all have a duty to protect our children. We all have a duty to make a report if we see something happening with a child that is of concern. Now I am going to take you briefly through my presentation. And as I mentioned, I will be presenting on the mental health services for children in state care provided by a psychology unit right here at CPFSA. Now we'll first look at the types of cases seen by our psychologists. Now, we see where a number of children sometimes present with symptoms or with, they're normally diagnosed with post-traumatic stress disorder, that is PTSD. So let's say, for example, there is a child who has been repeatedly abused, whether it be sexually, physically, and they are brought into care, and as a result, they have, a deep internal stressful state from this traumatic experience, and so they develop PTSD, and so these are some of the things that our psychologists would see. Another thing, a child may be sexually abused and brought into care. The caregiver may notice that the child have started to self-harm, the child has developed anxiety, and so we see these repeated PTSD symptoms. Conduct disorder and other conduct-related disorder. This is something our psychologist also sees and usually intervenes. Depression and anxiety, these two are really, especially now during these challenging times with the COVID-19 pandemic, we're seeing high levels of depression and anxiety, and so our psychologists would intervene to treat with same. Now, let us look at some of the interventions that are done by our psychologists. Individual and family sessions, both virtually and in office. So they have their sessions virtually, teletherapy as I mentioned earlier, and sessions in office where the clients would come in. Facility visits, these are also done by our psychologists when they would go into the facilities and they would provide the necessary psychotherapy for these children. Targeted interventions, this is not only done by the psychologists but as well as the children's officers on the mobile mental health unit, otherwise called the SMILES Mobile. Now we have our targeted interventions. I believe since the start of the year we've had three different facilities where we would go in and we screen for depression and anxiety, and we normally see high levels. Based on these targeted interventions, we see high levels of depression, as I mentioned earlier, high levels of anxiety, and we would provide our interventions right on spot where our children would receive whatever interventions it is required. We also make the necessary recommendations to the facilities, and of course some of these facilities would also have their programs in place to deal with some of these situations. Now, our psychologists also engage in psychological assessment, that is psychoeducational and personality assessments. So our children receive psychoeducational assessments and personality assessments. And this would give our psychologists a broader understanding of what is happening with each child, and they provide the necessary interventions. Now, onto our mobile mental health unit, in which I made mention earlier, I am a part of that unit as a children's officer. We conduct screening to determine mental status. And we screen using a number of instruments. The Strengths and Difficulties Questionnaire is one of them. The mental health screening tool, which is a structured interview that we do one-on-one with each child when they come on the bus. So this interview now gives us a broad background. It gives us more information as it relates to trauma, as it relates to what is happening with the child. We get to speak with them one-on-one and we gather that information. We provide routine services to government and private residential childcare facilities within the Southeast region. We also do crisis interventions outside of the Southeast region, where we're oftentimes called to the different facilities outside of Southeast to provide different interventions and screenings. Now, another thing that we do on the mobile mental health unit. So following the screening, of course, we would prepare recommendation reports for each child. So each child would have a recommendation reports based on the screening results. So what we recommend as a unit would be in that report, and this would be provided to the facility manager and to the child's institution officers. Now, following the recommendations, we also prepare referrals. So, of course, if there's anything happening out of the scope of our interventions that we provide on the Smiles Mobile, we refer the children. So they are oftentimes referred to see the regional clinical psychologist, or we do outside referrals to service partners such as Child Guidance Clinic. We also provide group and individual interventions to children. So we don't just screen the children and leave them at the facility. We ensure that interventions are provided in the form of group and individual sessions. So based on whatever it is that we see in the screening, you know, sometimes we see high levels of conduct issues, emotional distress, and we ensure that the interventions are targeted to address these areas. We also provide psychoeducational interventions to staff. So yes, we look after our children, but our caregivers within the facilities, our managers, we also want to ensure that they're doing okay as well. And so we ensure that each facility that we visit, we ensure that psychoeducational interventions are provided to the staff. So it could be self-care. Self-care is always a must. So that is one of our interventions for our staff. We do relaxation techniques. We provide a wide variety of interventions. We don't screen them, but we usually do the ACEs sensitization. And I mentioned earlier, the Adverse Childhood Experiences Questionnaire is an instrument that we use within the psychology unit. And you know, sometimes if the staff is okay, well, most times which they are, we administer the ACEs questionnaire to them when we're doing the ACEs sensitization. And of course, they're happy to know their ACE score, because we all know that if we have, or for those who know, if we have an ACE score, studies have shown if you have an ACE score of 4 or higher, you're at risk. You're at risk for mental illnesses, you're at risk for physical illnesses, you're at risk for a number of illnesses. And so this is something that we do with our staff within the facilities. And so when we provide this ACE score to them, we also provide, you know, preventative measures, what we can do going forward now that you know your ACE score. So these are some of the things that we would do with the staff. Now, performance of the MMHU for the period April to June 2021. Ms. McPherson and I would have been the other officer that works within the Smiles Mobile. We developed unit manuals. So I would have worked on the middle childhood year group unit manual, and Ms. McPherson, she would have worked on the adolescent year group. Now these manuals really surrounded targeted intervention. So what we did, we specifically developed sessions and interventions that we would use for these 2 year groups, so the middle childhood and the adolescent year group. And some of the topics in the manuals are conflict resolution, emotional regulation, relaxation techniques, and we do a number of other things. So our series of staff interventions and workshops, these were also done in the period of April, where we delivered a number of sessions via Zoom. Conducted screening at specific facilities. So this is our core function where we go out to conduct screening, and this was also done for this period where we would have visited a number of facilities and conducted screening, provided the relevant interventions. Ongoing sign language training for children with speech defects. Now this is something that I have been doing with one of the facilities, a very small facility that I've been working with, where I noticed a number of children, you know, have speech defects, their special needs, and so in order for them to better communicate with their caregivers, with their manager, we decided as a unit that, you know, they could learn some basic Jamaican Sign Language. And so I have been engaging a few children at this specific facility with sign language training from time to time. Okay, so we're now looking at some statistical data for our Smiles Mobile unit for the period May to June 2021. Now, some of what we have seen, so this is of course findings from our screenings during this period. Some of what we have seen, I mentioned earlier the ACEs, it is very important, our adverse childhood experiences. It measures the level of trauma a child would have endured. So trauma such as sexual abuse, physical abuse, family dysfunction. And once you have an ACE score of 4 or more, these children are at risk. And we see where ACE score of 4 and more, we had a number at 56% of the children at this specific facility showing 56%. And so, of course, the relevant interventions would have been and still ongoing, where usually when the ACE score is 4 and more, what we normally recommend as a unit is for a thorough medical to be done. Because the ACEs, as I said before, I will continue to repeat it, it tells you that you're at risk for physical illnesses, mental illnesses, and so we want to make sure that our children are okay. Moderate to moderately severe depression, 11% of our children showed signs of moderate to moderately severe depression, and so we would have made sure that we also intervene on this avenue. Now, our mental health screening tool, I mentioned this instrument earlier. It is an internal instrument that we developed as a unit, as an agency, and we use it to screen our children as well, where it will show, if you look at the bottom, it shows different levels of conduct issues, psychotic, depression, trauma, suicidal, self-harm, bereavement. And at this particular facility, we saw where conduct issues was very high. At least 80% of the children showed signs of conduct issues. Suicide ideations, we saw this as well, and so the right interventions would have been provided by the team. Our strengths and difficulties questionnaire, this is another instrument that we use as a unit, and so we see where the scores were very high. 62% of the children at this particular facility scored 62% in the very high risk zone, and this is a red flag, and so the interventions would have been provided and, as I mentioned, still ongoing. High risk, we had 25% being high risk. Slightly raised, we had 13%, and close to average, we didn't have anybody falling in that zone. Now, for the ACEs questionnaire, this is at a different facility. We had 46% of the children receiving very high ACE scores. We had, another number, a 10% receiving high scores and a 14% receiving slightly raised scores. 32% within the close to average range. And as I mentioned, the interventions would have been provided following this screening. And another SDQ result, this is also at another facility, just to get you to understand, what is happening with our children mentally and how we intervene. Close to average, 16%, slightly raised score, 7%, high score, 5%, and very high, if you notice, 23% of our children in that particular facility had very high SDQ scores. Now, right, I've come to the end of my presentation about our psychology unit, and I do hope you were informed. Thank you.
Thank you, Mrs. Spencer. Very informative, Miss Spencer. Very informative your information you presented there. Now, Octavia mentioned about the Smiles Mobile, and in April of this year, we got the fourth bus, our fourth mobile unit, which is through our ICT expansion project, supported by the Inter-American Development Bank and the Transformation and Implementation Unit out of the Ministry of Finance and the Public Service. She would have mentioned about a Miss McPherson. You may be wondering who is that. Is one of her team members who work here on the Smiles Mobile. And we'll definitely be sharing these slides with you at the end of our press briefing. And we will also take your questions, and we'll also use the raise hand feature to go with the questions. But now it's the time that we're delving, or we're going to be looking at the recent street and working children study. And coming to us, we have Mr. Newton Douglas, our Director for Policy, Planning and Evaluation here at the CPFSA. He's going to just give us an overview, what, the genesis of this study, how is the CPFSA involved in this study? And this will be followed by Mr. Doug Green, who is joining us virtually, who will also present, and then we'll end with the findings, recommendations, of course, by Dr. Joy Brown. Thank you.
Mrs. Rosalie Gage-Gray, Chief Executive Officer of the CPFSA, Dr. Joy Brown, Principal Director of the Institute for Applied Social Research, Mr. Doug Green, Program Officer, Human Rights Education Empowerment at Winrock International, Ms. Octavia Spencer, our social worker assigned to our Smiles Mobile Mental Health Services. Distinguished ladies and gentlemen joining us, colleagues, members of the media, good morning. The issue of children working on the streets is of grave concern, as the practice is indicative of a lifestyle of significant risk, wherein both their safety and health development as children are compromised. Unfortunately, the last survey on this vulnerable population was undertaken even before the passing of the Child Care and Protection Act in 2004 and the implementation of its provisions. Given the increased visibility of street and working children in recent times, the absence of the empirical data on the population, the need to design a response apparatus that is structured, impacting, and sustainable, the Child Protection Agency and Family Services Agency commissioned a study on children living and working on the streets of Jamaica. The purpose of the study was to determine factors which predisposes children to be living and working on the streets, and to identify gaps in the provision of care and social protection services that impede an effective response addressing this very important yet troubling issue to the government and to Jamaicans on a whole. To move forward, the CPFSA, an executive agency of the Ministry of Education, Youth and Information, with technical and financial assistance from our overseas-based Winrock International under its Clear 2 project, initiated the research body of work. The study was conducted across 9 parishes: Kingston and St. Andrew, St. Catherine, Clarendon, Westmoreland, St. James, St. Anne, St. Mary, and St. Thomas. Initially, St. Elizabeth was chosen. However, with little activity, the team shifted to the parish of St. Mary. Importantly, the parish were selected due to a number of factors: the high incident rate of child abuse, calls received from the CPFSA regarding children seen on the streets working, and of course a dipstick survey that was conducted over a period of time that informed us of what's happening at the local level in some of our parishes. Within the scope of the study, focusing on children between 5 and 17 years who live and work on the streets were taken to comprise those who sleep in public spaces without their families, that's children off the street; those who work on the streets during the day and return to their family home to sleep at nights, children on the streets; those who live with their families on the streets, that's street family children at the time of the study; and youth who were living, working on the streets before they attained the age of 18 years. The consulting firm Institute for Applied Social Research emerged as the preferred candidate to conduct the research at the conclusion of the public tender process executed in keeping with the provisions of the GOJ procurement guidelines. A technical steering committee was established to guide the research team throughout the study period from 2018 to 2019. The committee consisted of representatives from the Ministry of Education, Youth and Information, Child Protection and Family Services Agency, Winrock International, Planning Institute of Jamaica, the Ministry of Labor and Social Security, the Child Labor Unit. I'd like to use this opportunity to express thanks for their commitment and passion as they saw this process through. Before initiating the project, an application for ethical review was submitted to and approved by the Ministry of Health and Wellness Advisory Panel on Ethics and Medical Legal Affairs in June of 2019. This approach was necessary in guaranteeing that the rights and overall well-being of the children with whom we would interact are both respected and protected in the framework and during and after the execution of this study. The preparation of the Street and Working Children Research Study Report was guided by a series of engagement sessions comprising 24 focus group sessions with parents and guardians, 10 focus group sessions with children, 75 personal interviews with parents and guardians, and visits to over 58 urban centers across the 9 parishes mentioned earlier. Now, this level of engagement culminated with the hosting of a stakeholder consultation conference designed to share the findings of the research and to receive input from the participants. The attendees comprised representatives from key ministries, departments and agencies, civil society organizations, the academia, youth, children groups, the clergy, intersectoral committee, and the advisory groups. Plenary sessions were organized to allow the participants to review different thematic areas of the report, discuss solutions, and make recommendations across 5 key areas. And I share those. Improving interagency coordination, social mobilization, and marketing services. Innovative funding strategies and reform for social intervention initiative at the grassroots levels. Improving the policy, legislative, and institutional framework to guide meaningful intervention and a robust monitoring and accountability system. Working with families and communities to break intergenerational cycle and inequalities, and last, transforming harmful social norms and practices. The CPFSA recognizes the keen role that all stakeholders will play in creating an enabling environment to positively impact the outcomes of our children and their families. As our mandate to provide care and protection for children who are at risk or otherwise deemed to be in need of care and protection, we will, in collaboration with our partners and our stakeholders, lead the execution of the provisions of the response framework of action. As the research indicates, and we'll hear a little more later on, poverty is the most obvious push factor for child labor on the streets, and the potential for quick monetary gains is the most significant pull factor. We are therefore looking at introducing and implementing programs that will target both our children and their parents. We must first start with our parents, and this will be achieved through the executing of our positive parenting campaign, which will focus on social norms, beliefs, and attitudes. The essence of this campaign is to achieve behavior change. If we can help our parents to become more effective in their parenting styles and empowering them with the means to provide for the needs of their families, then children will not need to focus on monetary gains instead of educational gains. We also will have to educate our children and by extension our families, ensuring that street life is seen as unattractive so that they can stay focused on achieving an education and becoming gainfully employed, start families of their own, and be model citizens in their communities. The CPFSA remains committed to the mission of empowering children to achieve their highest potential and supporting families as part of nation building. We look forward to working with our key stakeholders in order to effect change. Thank you very much.
Thank you, Mr. Newton Douglas, our Director, Policy Planning and Evaluation here at the CPFSA. I forgot to introduce myself. So I'm Rachel Dixon-Gordon, Public Relations Manager here at the CPFSA. We are now going to be joined by Mr. Doug Green, who is on your screens. Of course, he's joining us virtually. He's the Program Officer, Human Rights, Education and Empowerment at Winrock International. So, Mr. Green.
Thank you. Good morning, everyone, and thank you to the CPFSA for inviting Winrock to attend this important event. As was mentioned, my name is Doug Green, and I'm speaking on behalf of Winrock, which is a US-based nonprofit organization that works with people around the world to increase economic opportunity, sustain natural resources, and to protect the environment. Winrock provided technical and financial support, as Mr. Douglas mentioned, to the Street and Working Children Study as part of the Clear 2 project, a multi-country U.S. Department of Labor funded initiative. Under Clear 2, Winrock worked collaboratively with host governments in 6 countries, including Jamaica, to provide technical assistance to bring about meaningful reductions in child labor. Clear 2 operated in Jamaica in 2018 and 2019, and we worked with MLSS, with the CPFSA, and with other key stakeholders to implement activities that supported the government of Jamaica's priorities in addressing child labor. These included training of prosecutors on child labor cases, supporting the development of a national action plan on child labor, and the establishment and support of a child labor coordinating body. Winrock was a member of the Street Children's Studies Steering Committee, which was led by the CPFSA. Our team members included Clear 2 Project Director, Ms. Rocio Cordova, Country Coordinator, Mrs. Cheryl Davis-Ivy, Technical Advisor, Ms. Carrie Richter, and myself as a Project Manager. Together with the other steering committee members, the Winrock team helped to provide technical oversight to the study, monitor its implementation, and validate findings. I want to acknowledge the CPFSA's leadership and insights in directing this important study. Mrs. Rosalie Gage-Gray, Mr. Newton Douglas, and their colleagues helped guide the methodological approach and provided critical oversight and technical feedback. I would also like to recognize the tremendous efforts of Dr. Joy Brown and the IASR team, who spent countless hours in the field and produced a thorough and expertly researched report. The report will not only improve the body of knowledge on the critical topic of children working and living on the streets, but also further targeted responses for this at-risk population. I would also be remiss if I did not recognize the contributions of the MLSS Child Labor Unit under the leadership of Mrs. Sasha Deere-Gordon and Divisional Director Ms. Jillian Carotis. MLSS was Winrock's primary government counterpart under the Clear 2 project, and its vision and support were central to the success of the project's interventions, and the insights and collaborative spirit of Mrs. Deere-Gordon and Mrs. Carotis did much to further the study, as well as other Clear 2 activities. When Winrock began planning for Clear 2 operations in Jamaica several years ago, CPFSA emphasized the importance of carrying out a study like this. And in Winrock's initial consultations with government officials and NGO stakeholders, the issue of street children was raised as a priority for tackling the overarching child labor issue. Winrock worked closely with the CPFSA and with IASR as the study moved from literature review to scoping, fieldwork, and to the development of the report itself. In the report, Dr. Brown has laid out key recommendations for a package of care that addresses this vulnerable population. The study provides needed evidence to ground such interventions in the actual situation that children working on the street face. It also sets a strong foundation for key initiatives such as the recent establishment of the Street and Working Children Task Force. The Clear 2 project closed in 2019, but Winrock remains in Jamaica with the Jamaica U.S. Child Protection Compact Project, which is funded by the U.S. State Department and focuses on combating child trafficking. Through the State Department's support, Winrock and other implementing partners support the government of Jamaica's efforts to strengthen the system's level response to child trafficking. Winrock works closely with NAFATIP, the CPFSA, and other MDAs on the CPC project to tackle this important issue. Winrock thanks IASR, the CPFSA, and the government of Jamaica as a whole for their leadership. We look forward to continuing to support initiatives led by the government of Jamaica. Thank you.
Thank you, Mr. Green. We're now going to invite Dr. Joy Brown, who will take us through the next session or the next phase of our press conference, followed by your questions. Dr. Brown.
Thank you very much. Mrs. Gage Gray, CEO for CPFSA. Mr. Doug Green, Program Officer, Winrock International. Mr. Douglas, Director of Policy and Planning for CPFSA. Ms. Spencer, Social Worker for the Psychology Unit. Ms. Dixon, Public Relations and Communication. Members of the media, distinguished guests who are joining us virtually. Thank you for inviting me and welcome again. Mr. Douglas did a very good overview of the study, and so I will not focus on the areas that he has already covered. But I wanted to start with just a snippet on the methodology that was used for the study. Earlier, when the study was designed, the idea was that we'd use what was called a capture-recapture methodology. We had to shift that somewhat, and I wanted to explain what we did. I also wanted to underscore that ISR found it important to go beyond examining children who worked in the urban centers. So we also went beyond traditional ways of looking at children on the streets, so that earlier studies on children on the streets would look at those that focus on child labor in a specific way. Our mission was to concentrate on children who were on the streets specifically, and so we have to distinguish that from earlier studies where we looked at child labor, but child labor would focus on children who were both on the streets and those in industries. We were focused only on those who were on the streets. So therefore we excluded children on the farms and other establishments. All right, now it's important to pinpoint what we mean by the streets. Our studies typically focus on the major thoroughfares and capture children who work at, the predominant locations such as Halfway Tree, the areas where we normally see children. Less attention is paid to child work on community lanes, and here the dynamics differ considerably. So our research pays attention to children on the lanes and those on the major streets. I mentioned that there is a methodology, capture-recapture methodology, in which the idea would be to first identify children who are particular hotspots, and then to go back after a period and to investigate whether they were still there, and to sort of get the numbers of children based on those estimates. We found that that didn't work very well for this study for a number of reasons. Children were less visible than anticipated, because at the time that the study was conducted, there were reports that the CPFSA was actually gathering children up and placing them in state facilities. And so children were very afraid of being seen. Street men were perceived as threats to children, and they have now taken over positions that were once occupied by children. So, according to the rules of the road, children can be chased or hurt if they venture into areas that are owned by these men. And so we did not find that a lot of children were very visible on the streets. And so the capture-recapture methodology did not work in that situation. Now, there's also a strong perception that the major thoroughfares are considerably more dangerous. There are threats of drive-by shootings, of kidnapping, of murder, rape, extortion, and thefts. And so because of this, we also have less children on the major thoroughfares. During the period of the study too, when we were working particularly in Maypen, there were violent flare-ups, and so we didn't have children on the streets. Also because of the Zozo operations, that the children on the visible thoroughfares were less. And so the methodology did not work very well for us. So we shifted. The research team recognized that we had to do something that was very different. And so the revised research strategy was largely respondent-driven, although we tweaked it somewhat. There are a number of things that we did. Key community personnel were rewarded materially for recruiting children who work on community lanes and major thoroughfares. We also liaised with the parents and the guardians of the children. We went into schools. Teachers facilitated interviews with students who worked or hustled on the streets, and their rewards were non-material. There were church groups and missions who serve children who work or hustle on the streets, and these groups largely consider the prospect of helping children sufficient incentive to participate. Children got a number of rewards for participating. In some contexts, children got snacks, and we did not pay them for participating, but they got snacks, they got other non-material rewards. And then we corroborated the results by doing transit walks and observation through the zones. Children were very good at providing links to other children who worked on the streets. And so this is called snowballing, and that was a major feature of what we do. All right. So Mr. Douglas outlined the parishes, and he suggested why we focused on those parishes. I should point out that the team was initially, at least, viewed with skepticism. And this was because of the sensitivity of the issue. So some of our key stakeholders withdrew because they felt that they didn't want families to be disrupted, and they didn't want the backlash of parents who would say, you know, you shouldn't have removed our children. That was the perception of what the CPFSA was doing. So that posed some difficulty for us. All right, so with Mr. Douglas Tolley, we did 75 individual interviews with parents. And I need to say that one of the main reasons was because this was such a sensitive issue that many parents did not want to discuss the matters in a group session. 413 questionnaires were administered to children rather. We analyzed 373 of these, largely because we found some of the data not reliable. Not reliable meaning some children did not complete. They ran off in the middle of the session. And some of those, we recognize that these were children who were involved in child labor but not on the streets. So we took out everything that was not pertinent. 20 focus groups were conducted, and we conducted focus groups with children as well in Spot Valley, Windsor and Seaview Heights, Majestic Gardens, Jonestown, Callaloo Mews, Riverton City, Rocky Point, Whitehall and Red Ground. So what we're trying to show is that we went deep into the parishes, deep into the communities to get the data. Okay. Now let's go to the findings. It is perhaps not unexpected that the highest proportion of children on the streets are between 12 and 13. They comprised 15.72% of the sample, and 14.63% respectively. 38 10-year-olds were interviewed, and these comprised 10% of the sample. Children between 5 and 9 years constituted 10% of the sample, and children between 15 and 17 years comprised 28% of the sample. The majority of respondents were located in Kingston and St. Andrew, followed by St. Catherine, St. Anne, Westmoreland, St. Thomas, St. Mary, and St. James. In Clarendon, only 11 children were interviewed, but this was because of the upsurge of violence in the area at that time, so we couldn't conduct the interviews in the way we wanted to. Now, from the study, only a small proportion, just 5% of the children actually sleep on the streets. 94% return home. Of the 18 children, of the 5% who sleep on the street, 15 were boys, and the remaining 3 were girls. Children are asked to identify where they sleep on the streets, and this is a selection of their responses. In the stalls, that is in the market stalls. One said, I stay with a youth on a step. When my mother gambles and bleaches, that means that she stays out all night, I lay down on a table so that I'm not alone at home. On a shop plaza, in a car, on the roadside by the market, in a truck on the open road, one said in Sam Sharp Square, another at a gas station. 42% of this category of respondents feel entirely unsafe sleeping on the streets because they recognize the possibility of being raped, of being killed or beaten. And so they would say, for example, a man can drive up and take me away. People may draw me away. I'm afraid of getting killed. I'm afraid of attacks, or I can get raped. We asked, why do you work on the streets? The large majority said that they work on the streets because their family needs the money to survive. It was not because the parents cannot take care, but because the family needs the money to survive, and so the children chip in. Notably, 80%, over 80% said it was not true that they were forced to help. 85% said that it was not true that they helped because they were abused and ran away. So that was not the reason. But 57% said it was quite true, and 10% that it was partially true. So that 67% work or help on the streets because the family wants to make quick money. Let's go further. Now, over 86% of the respondents acknowledge that they have done something to earn money in exchange for rewards. And this was, we asked this question, what have you done in the past week? Over 86% had done something to earn money. And they had done this for at least 1 hour in the past week. In Jamaica, children and parents prefer to refer to hustling rather than working. And that is because of the perception of work being illegal, but hustling being allowed. And not only allowed, but valued. And so the largest single proportion of girls started hustling at 10 years. The largest single proportion of boys started hustling from they were 9 years old. 6% of the girls and 4% of the boys stated that they started hustling when they were less than 5 years old. The major proportion hustle, they work or they beg each day of the week, while 16% hustle 4 days for the week. And 18% hustle 3 days for the week in the course of the week. So children who claim not to hustle stated that they still helped their caregivers and community residents in a number of ways. And this could involve pushing hand carts, taking care of siblings, carrying bags, washing clothes for others in the community. Now, we should point out that the majority, 72%, attend school most days. 18% attend sometimes, 10% used to attend but no longer do, and the remainder never attended school. So that is less than 1%. And it's important, the majority of the respondents were mobilized within the community. It was not a school-based exercise. And so it's important to note that the sampling approach was not skewed towards children in school. Therefore, it's a credible finding the majority of children who hustle also attend school. The majority, of course, do not attend school on Friday. And here it is known that many parents withdraw their children on Fridays, as this is a day for preparation for market and other activities. The survey was administered during the school term and outside of the school term. And so some children said that they did not attend because school was not in session. But 29% stated that they did not attend school. On the days they did not attend, it was because they did not have the funds needed to purchase books, lunches, or school clothes. And this again points to the importance of poverty, particularly consumption poverty. Among children who no longer attend school but hustle, they had been expelled for behavioral issues such as fighting. Children gave other reasons for leaving school, such as, we did not do the subjects. We hardly went to school because of money issues. Both parents died. One young man told me that he was threatened by a parent that he would be shot, and therefore he left. I stayed away from school for too long and could not re-attend. And so the evidence does show quite strongly that consumption poverty is the most obvious push factor for child labor on the streets, while the potential for quick monetary gains is the most significant pull factor. Children explain that they work at various spots on their lanes in their communities and on major streets. And as I explained, children are resorting to the lanes because of the perceived threat on the major thoroughfares. Some children say they had no particular spot, they just walk up and down the road. I think it's important for us to go beyond our traditional conception of poverty. The literature has gone well beyond that, and it's important for us to do that. What are the weights? What are the weights to chronic poverty? In our investigation, we found out that family breakup and dislocation is one key contributing factor to the levels of poverty that in the majority of cases appear to be among the root causes for child work on the streets. School, the education system, is a push factor for some children. And here you would have children explaining the way that they are treated by some teachers, that constitutes a push factor, but also the levels of violence in school and the way they are treated by peers as being a push factor. Learning challenges compound the problems for children on the streets. We did a component of the study involved testing children who were on the streets, and we recognized that many had severe learning challenges. And then there are intergenerational roots to poverty, low education levels, and choices. I wanted to pinpoint here that in some of the communities that we went in and we spoke to the parents, particularly the mothers, we'd ask them, at what age did you leave school? Almost universally, they left school at about 16. And many had had 3 children by 19. They had not completed. And so what we have found is that the patterns get passed on within the families. So there are critical intergenerational roots to this poverty. Ill health, particularly of parents, was another push factor, where children said, my mother was sick, therefore I could not attend. Peer influence, let's go and work on the streets. And then hustling, which is now seen almost like a family tradition, is a huge competitor to children, huge competitor to education rather. Hustling is sometimes preferred to going to school. And if we look at the data, we ask children, from your family, are you the only child who's working on the streets? 65% of them said, no, we're not the only ones. I have sisters and brothers who also work on the streets. My mother, father, other caregivers work on the streets. My best friend also works on the street, so it's almost like a network. All right. Let's look at some other weights to chronic poverty. The inadequacy of safety nets. We know that we have the PATH mechanism, but when we spoke to many families, this was inadequate. There are some cases where we were told that parents or mothers particularly don't necessarily spend the funds on the children. There are some communities that we have gone into where they have made it clear, children have made it clear that they prefer that the funds be given to the schools directly because parents are using the money to adorn themselves or for partying and all of those things. Insecurity is another major push factor. And insecurity has a number of caveats. It's not just violence, but there's insecurity in the family in terms of abuse, insecurity in the communities. It's another push factor for children. One of the things that we pay less attention to that than we should have, we normally talk about behavior change and the way people think without recognizing the belief systems within communities. There are actually spiritual roots and supports to chronic poverty and family dislocation. And so we found that in many communities, children and families would talk about the role of witchcraft and the way in which their beliefs, their perceptions that, you know, their family had been cursed or that people had been involved in cursing their families and that this had affected them across generations. Those were important factors. Not only that, but drawing on another research and also on this study, we spoke to a number of children who are involved in scamming because, you know, it's not just the children in poverty who are on the streets. We have children who make money on the streets as scammers. And they report going for protection and feeling emboldened by the protection that they get from different spiritual sources. And that causes them to engage in diverse risky practices because they feel emboldened by it. And so the truth is that we have to go beyond. If we're going to be comprehensive in our approach, we do have to look beyond the way we normally think of development. We have to look beyond this, looking at behavior change and thinking that behavior change can be delinked from the spirit. It really cannot. The way people think are the spiritual roots are fundamentally embedded in the way that people think, and it influences them, and so we have to contemplate, have to look at these issues as well. And then, of course, there are power relations and dynamics. What power structures are in the communities? How does it influence what happens? Wish done, and now we have done who are young children as well, who are sending out other children, would command children to go on the streets to work. So these are issues that we do have to study very carefully. With respect to the specific activities on the streets, 68% of the children hustle or work or beg on the streets in the daytime only. 26% are on the streets in both the day and nighttime. 57% of those who hustle in the daytime do so after school, 16% on weekends only. And so this pattern is the same as that observed in the 2002 study, so that in which the majority of children on the streets do attend school and are seeking funds to support themselves in school or to boost family incomes. Now, what sort of activities do our children engage in? Among the daytime activities are selling snacks and grown provisions. 65% of the children confirmed that they were occupied with selling goods such as snacks, sweets, newspapers, and grown provisions. 29% wipes, car glass, and wash cars. 12% hustling nightclubs or at parties. Because we conducted the study across different parishes and communities, we're able to differentiate types of activities by community and parish. In Kingston and St. Andrew and St. James, there are children who live off the dump, such as in Riverton. And there's another dump in St. James, and they sell scrap metal, loom, and copper. Children from one particular community report that they collect money from sponsorship papers, and what they do is to sort of fabricate a venture to say that my school is having this sports activity, for example, and they collect sponsorship largely for themselves and for their families. Prostitution is common in some communities. It is common among girls, but it also applies to boys. Prostitution was cited in Kingston, St. Andrew, St. James, St. Anne, and St. Mary, and also in Westmoreland. In St. Catherine, there are some children who reside within fishing villages, and these children, some of the girls, sell sexual favors to fishermen or otherwise beg for a living. I'd mentioned before, there are also rich children on the streets. During the course of the study, we met some fairly wealthy children who work on the streets because they want to make additional money to promote their industry. So one young man told me, I work on the streets. Although my people have money, I want my own. Some children are involved in diverse jobs, including exotic modeling and dancing. One young lady told me that she earns approximately $20,000 per stint. One day I was going to a party, she says. The boss saw me and asked if I would like to model. I said yes. He said I should follow the group. We model in bathing suits. People tip us when we model. We are trainees. And as trainees, we make $20,000. We go all over and model. And then she showed me numerous photographs of partially nude girls who were made to appear as adults. We asked children in some communities whether they had a boss or a general who protects them and provides for them, and for whom they were required to report and submit a portion of their earnings. They had different interpretations of the term boss. Some children are employed by adults on construction sites. There are some reports that the Chinese have employed some children in their wholesale, but that this practice is declining somewhat. Some children are hired by senior family members. Some are commissioned by gang leaders. In one community, I remember distinctly that a young girl, she was about 9, she reported that their boss was a youth who sends them out to work and punishes them when their earnings are too low or when they fall out of line. And punishment here involved holding the children's heads and knocking them together, or cutting the children with knives and other physical attacks. And while these reports are in the minority, it's important to point them out. So 11% confirm that they have a boss or general. And of this subsample, 81% felt protected by their bosses. 62% were provided with jobs. 51% had to submit a portion of their payment to their boss, and 11% were punished if they do not follow orders. And this is where, in terms of the analysis, we have to understand what we pointed out as the power relations and dynamics that get replicated among children from such an early age, that a child of 9 years would already have a boss who commands. And then what are the implications as they grow up? What exactly occurs? And so I wanted to just, give an idea of the children who claim to have a boss. There's one young boy, he was 9, he works in construction, he carries drugs, he has broken into a house, and he says his boss employs a lot of children. He can't count the number. In St. Thomas, there is a boy, he is employed for 3 years, he sells bag juice and sodas, he's in construction, he carries cement and other heavy loads. His boss employs between 3 and 6 children. There's a male, 13 years in Kingston, who begs, sells ackee, guinea, other fruits. He's also part of a crew and is employed by a boss. Female, 9, Kingston, sells produce for her boss, has broken into a house. Boss employs a number of children. Male, 15, works in construction, drives a taxi at night. Boss employs 3 children. And so on. Exotic modeling and dancing. Female, 17, carries drugs. Look out for police while a crime is being committed. And so this is where we get into hazardous occupations. And of course, the proportions who report that they're actually involved are low and maybe lower than what is actually the case. But there are children who report lifting heavy loads, mixing cement, working in places with dangerous equipment, breaking into houses, carrying weapons, carrying drugs, looking out for police. We asked children about their involvement in sexual activities. Very few, well, we had 14 who said that they were forced to have sex with someone who is about their age. 5 had sex with someone younger. 5 had sex with a younger man, with an older man, and 9 with an older woman. All of these many times. But then when we add those who had said few times, we have a slightly higher proportion. 8 had sex with someone about their age a few times. 4 with an older man a few times. 10 with an older woman a few times. There are communities where we recognize that this abuse of boys was not only occurring because they said that big men would drive into their communities and have sex with young boys, but that women were also involved in sexual relationships with young boys. And the same thing happens to girls. It is a mistake in our policy to ignore what's happening to our boys. It is a mistake to undermine the abuse of our boys. All right, so a series of life stories were conducted in one community where prostitution is common among older women as well as children as young as 10 years. Here in this community, prostitution is not frowned upon, but is regarded as a rational response to hard times. Most of these older women had started the sex for money trade when they were teenagers, and they reported that the same pattern continued among the young girls from 10 years. Conversations with boys in that same community, as I said, confirmed that big men venture in to have sex with some of their peers, and they also arranged to meet them on the outskirts of the community. There are other boys across the parishes that we interviewed who told us that they maintain 3 or more sexual relationships in order to ensure that there's someone there if the other leaves. And of course, we understand that there are boys who ply the streets of New Kingston and also solicit boys and men on the streets. We asked children to identify their worst experiences on the streets. They listed being involved in fights, police taking away their goods, being hurt, being robbed, involvement in car accidents. Some described the agony of losing the funds that they had worked for. Children reported they were vulnerable to sexual exploitation. They reported being harassed by the police. Girls told us of being subjected to rape and being kidnapped. Some said that they were stabbed. And given these threats, they preferred to remain close to their communities. Those then are the major findings. And I wanted to reiterate what Mr. Douglas has already pointed to in terms of the recommendations. Okay, now we have said that intergenerational issues are critical. And because we're talking about intergenerational issues, this would suggest that our social policies over many years have not been adequate to solve the issues that families are facing. And that is why we have these conditions being replicated. And so it is important to stem intergenerational inequalities such that families can transcend conditions of poverty. And this necessarily involves implementing an aggressive, transformative income generation program for parents and guardians, arresting low educational achievement across generations. We have to focus on the norms, the beliefs, and the values that influence choices. And I've pointed here not only to, what we conventionally see as constituting behavior change, whether or not you should work on the streets, the value placed on hustling, but I've pointed also to spiritual beliefs and to beliefs that we can do nothing else, and addressing those. We have to address the learning and psychological challenges among children on the streets. And this means tackling the push factors such as inadequate ways of certainly work for children who have special needs would be one, but other learning disabilities. We have to expand our program not only for children on the streets but those who are at risk, so that we prevent new cohorts of children from entering the streets. And we had spoken about implementing the child labor legislations. Jamaica is particularly good. We know we form good laws and we would have good policies. Implementation has always been a major issue. So devising ways in which we can actively implement the legislations and the policies are critical and they're urgent. Thanks very much.
Thank you, Dr. Brown. We'll now take questions. I'm asking that you use the raise hand feature and also identify yourself, and we will then ask either of our panelists to respond to your questions. All right, Jordana Murphy from the Gleaner. Can go ahead with your question, please.
Good morning, everyone. I have a couple questions, but I'll present the first two. The report recommended developing an effective marketing program that will advocate against child work on the streets. How soon will this be actioned? Number two, what is the plan of action for preventing a new cohort of children from entering the streets? So I'll give the CEO the opportunity to respond to those two, and then I'll move on to the other questions.
Okay, so we'll take the first two. Mrs. Gage Gray.
Hello.
Go ahead. Yes, the mic is on.
Good morning. Thanks for the question. So as you know, the recommendations have been made, and is it a task force? Is being set up to action the recommendations. Now, as part of our ongoing marketing and public education, we have targeted positive pairing as a major campaign that we are doing. And you would have heard from the report that Dr. Brown gave that a lot of issues with parenting and parenting involvement and resocialization is going to be critical. So these are things we are working on actively, and those campaigns will be launched this year. And so you can look out for those.
What was the second question? Plan of action to prevent other children from
Right.
entering the streets, right?
Right, so our continued work with other stakeholders, the police, other community members, this study has given us empirical data that looks at specific communities that the children are, and so the work within those communities, working with the schools from which these children are, is going to be very critical in that process. And so trying to get those who are on the street, as you know from the research, it is said that a majority of them go home in the evenings and they are not there all the time. So how do we, and they move from spaces to spaces, especially within the corporate area. So our efforts now is to get those who are on the streets now off, and to work with the communities to do the intervention with parents and families within the communities so that they won't have the need to go. This is gonna take a lot of collaboration with other stakeholders, because from the research you would see that the needs that they have is not necessarily a child protection need, but there are other social protection needs that they have that needs to be addressed.
Thank you, Mrs. Gage Gray. What are your other two questions, Jordana?
So question three, the report noted that child services are fragmented and that there is no strong coordinated agency that is sufficiently resourced to monitor and evaluate interventions that are put out. What is the CPFSA's plan in this regard? Number 4, how does the CPFSA intend to meet its 2023 target of having 75% of children in familial environments? And my last question, I'd like an update on the alleged child abuse at Maxfield Park Children's Home, which led to the
Mrs. Gage-Gray?
First question is with respect to
Fragmentation
the
of
fragmentation. So we have the National Plan of Action for an Integrated Response to Children and Violence, and that committee task force is meeting to address the issues of having all stakeholders, whether it's ministries, agencies, departments, and other NGOs working together to address the issues affecting children. So that's one methodology that we are using to address that. So the plan has 5 outcomes, and we are working assiduously with the different stakeholders to ensure that our response to the issues affecting children can be addressed in a holistic way through that plan. So that's the platform we are using to have all of us working together. Within child protection, we also have the multi-agency dealing specifically now with the issues affecting children more directly in terms of sexual abuse with SISOCA and other entities like that, where we have officers from the CPFSA working closely on the ground to respond to issues that are affected there. And Rochelle, you have to help me with the running order of the questions.
Sure. And then this fourth question is the 2020 target to have 75% of children in familial settings.
Right. So, as a part of our gatekeeping strategy, we believe, and we are following the international guidelines for alternative care, which speaks to the necessity and the suitability principle. The necessity principle states that, is it necessary to remove this child from this circumstance? And if we look specifically to the study that we just did, what are the pull and push factors that are causing children to be on the street? If we can get behind and address those issues, then you won't have that problem. And so what we are looking at is, when we intervene in circumstance, what intervention is necessary to prevent those children from coming into direct care? And how can we support families and parents to be able to better take care of their children? So that's the approach we are taking, and we are at 65%, and we are working, with the several programs that we have. We have been remanding much less children in direct state care. Our investigators, as you would have seen those numbers, receive between 800 and 1,000 cases per month, and they are remanding about 2% of that figure. So majority of the children are not coming into direct care. We have our children and family support unit that provides real-time support to families and the children, and so we keep them in the families and provide the services there. For our special needs children that people would normally want to hand over to the state, we are providing support to the families so that they don't have to come into direct care, and that's how we plan to work with families so that the children don't have to come to us. Our first priority is not to remove children from their families, but to provide the support within those families so that parents who have the responsibility for their children can take that responsibility with the support that we can give them with other agencies.
And then the fifth question is child abuse case at Maxfield Park Children's Home.
I think that matter is still with the courts, and as we can't really comment on matters that have been with the courts. As we have said before, we take a zero tolerance to all levels of abuse within childcare facilities, and we actively investigate and report to the relevant authorities. That's the Office of the Children's Advocate, and also to the police through SISOCA, and action is taken. So we can do the internal disciplinary proceedings, but once the matters are before the court, then those matters are addressed accordingly based on those court outcomes. So that's all I would say on that matter with respect to Maxley Park.
Thanks, Mrs. Gray. Corey Robinson from the Gleaner Company, your hand is raised. Can you go ahead with your question, please? Good morning, Mr. Robinson.
Yes, ma'am. I want to have several questions. Well, well, several questions to Mrs. Gage Gray as well as the researcher. Let me start with researchers. First, and this is a follow-up to Jonathan's question, right? How would you into the street boys study that was unveiled today? And if it did not, isn't this study dated? That's the first question. Secondly, in regards to the presenting of mental health issues, I noted that she spoke primarily about the children with issues within the children's home. But if it is that, the CPFSA is pushing at home, right, and get assistance from there. How do you, well, what can you say of in terms of your visits to persons outside of the children's home? What assistance have been given to those children? And then you can answer those, and then I get back to Mrs. Gray's question.
All right, so Corey, I'll ask Dr. Brown to take your first question about COVID-19 factor and its impact on the study. So Dr. Brown will respond to that, then we'll follow with Mrs. Gage Gray for the second question.
Okay, thank you. The study was conducted prior to COVID-19, that's the first thing. It was conducted prior to COVID-19. It was conducted a year ago. We can think about what the implications would be, meaning that with COVID-19, I'd expect that there will be less children.
Oh my gosh, man.
Sorry, you're not hearing Mr. Robinson?
Yeah, no, Mike, there's nothing coming from her, Mike.
All right, so
So the findings would differ considerably from what would happen under COVID. One would expect that there'll be less children on the major thoroughfares, particularly during COVID-19, but perhaps you'd find children on the lanes, because with the curfews and so on, we found the curfews are less observed on community lanes, and so you'd find children on the lanes but less on the major thoroughfares. So that would be my estimation. We did not investigate the issues since the pandemic, but that would be my estimation.
thank you, Dr. Brown. And Corey, your second question, can you repeat it, please? For Mrs. Gage Gray? Mental health.
I was asking prior to that for the first for the mental health cases.
Okay.
Presented primarily on those children who are in the state homes.
Right.
Now I'm saying if the goal is for the CPFSA to have as much children remain at home with their parents, what does she say in regards to the efforts on the ground to get those children who are not in the state care?
So she was speaking primarily to the work that they do within this children in state care. Now, the children who access our services get that support through our Children and Family Support Unit. So those children who access the service to Children and Family Support Unit are not in direct state care, and that's where they get the support. Now, you would have heard of our groundbreaking for the therapeutic center to be built at Maxwell Park, and that center will also take in office children who are referred to us for that service. So that's how we intend to provide that support. We work also with the Ministry of Health through their child guidance clinics, and the referrals are made there as well. And we also use private practitioners who we do refer children to. most times at our expense as well. So that's how we plan to assist those children. But the presentation was primarily to children who are in direct care, because they go from home to the screening assessment and the necessary intervention that is done as well.
You had another question?
Yeah, man. Finally, in regards to the researching, would the prosecution of parents be a feasible recommendation for the street children, or from the street children study, based on the data gathered and why these children are on the streets?
I'm going to take that first.
Mrs. Gage will take part of it, and then we'll ask Dr. Brown to also add to that question.
I'll answer like this, Corey. We don't want to go that route first. We want to provide the necessary training and intervention for our families and parents, and give them the necessary information for them to make informed decisions as to how is it that they are going to take care of their children. The Child Care and Protection Act says that parents have the ultimate responsibility for their children. And if with support, they can do a better job at that, then the support should be given. And that's where we come in through different programs that we have that seeks to assist parents, and through the National Parenting Support Commission as well, who provides support for parents within communities and within the school sector. So I think whilst if there are very, very severe cases of neglect and abuse within the household, and parents must be held accountable for those, our first point is to provide the information, providing the support, so that they can make the informed decision. So that's where we are going with the Good Parenting or Positive Parent campaign that is to be launched shortly, that is seeking to provide parents with the information, with the support for them to better take care of their children, because it is their responsibility.
Thank you, Mrs. Gray. Corey had another question. Oh, let's ask Dr. Before you go to the next question, Dr. Brown wants to add to that question you've asked earlier.
Well, yes. It is important to remember that we're dealing with intergenerational issues. And because they are intergenerational, we cannot just solve it by prosecuting parents. We are talking about policy issues and programmatic issues that over years, over time, has largely not served particular segments of the population very well. If we were to think about it in this broad way, then our response would have to be also longer term and broader, and not immediate prosecution. That would not be helpful at all.
Thank you, Dr. Brown.
No problem.
Yes, Mr. Robinson, you have another question?
All right, my final question, and this goes primarily to Mrs. Gage Gray, but the other members of the panel as well.
Okay.
Jamaica has found itself in a rather precarious position in regards to crime and violence. Based on my preliminary records, at least two dozen children have been either shot and injured or murdered since the start of the year. I would like to know, would the CPFSA support a call for a comprehensive plan to deal with children affected directly by crime and violence? Children how many children are left without parents? How many children have been killed or injured in gun battles since the start of the year? Would you support a plan and give me an idea as to what that plan would entail, Mrs. Gray, and the others who are there, the professionals? Thanks so much. Those are my questions.
All right. Corey, there is actually such a plan. There is a National Plan of Action for an Integrated Response to Children and Violence. It's a multi-agency, multi-stakeholder plan that is chaired by the Permanent Secretary in the Ministry of Education, Youth and Information, that is seeking to look at, I think, 5 outcomes. One has to do with the legal and policy framework. There's a big plan for communication as well, and some other areas there. We can share with you the roadmap that we have for that plan that will outline all that is being done. I would agree with you that there is and there has been severe impact on our children based on the level of violence within communities. We have a first responder program here where once those incidents occur, then we go into the communities with other stakeholders, victim services, the police on the ground to do early intervention. We have found that a lot of the children that do come into our care would have experienced trauma before and was not assisted or it was not treated, and then it becomes a problem later on. So we introduce our first responders program where investigators and other social workers would visit these communities with other first responders, as I said, the police, victim services, and provide early bereavement and grief counseling. We inquire from a social work perspective whether or not additional support is required. So if a parent is killed, who are the other caregivers there who might take custody of this child, and what support, if any, this child would require. And we seek to work with the community, work with the extended family, and as a last resort, some of those children are taken into direct care. But the support that the children need we heard yesterday 2 youngsters were killed in Westmoreland, and the incident occurred in the view of 5 children. So those children are gonna need continued support right away, and our officers are on the ground providing that kind of support. So the long-term impact of trauma, as Octavia spoke to in terms of ACEs, is well documented, and we have to ensure that we are providing, we are screening, we are assessing, and we are providing the services for children. We have to work with the school system or guidance counselors in that area and other community members so that we can really arrest the issue. We have trained our officers, social workers in trauma-informed care. How do you treat with a child who has experienced trauma, and what support does that child require? And that's how we are rolling out. We are seeing the psychological impact of our children, that the trauma and violence of our children, as a national priority, and we are treating it as such.
Thank you, Mrs. Gage-Gray. Any other questions? Corey, could you lower your hand, please? Any other questions? I see Cody and Barrett is on. Any questions? Okay. So with no other questions, we want to thank everyone for joining us for our quarterly press briefing. We were able to share with you what's the status of children in the care of children's homes and places of safety, as well as generally in our family programs, our familial environment programs. We were able to also share with you the recent street and working children outcome of that study. And so it was a pleasure to really talk to you also about mental health services we have been providing for our children in state care. So until another 3 months, we will be able to update you as to what's happening in the CPFSA, and we want to thank you for joining us. Thanks to all of our executive management team members who joined us, as well as other members who were resource personnel, and for the media for joining us. Thank you so much, and do have a great day.